Hi, my name is Jackie. I was diagnosed with type 1 diabetes when I was 8. I play hard because that's how I do everything. I always push myself to be the best that I can be. Type 1 diabetes does not stop me from doing the things that I like to do.
Hello and welcome to Teen 1D, the podcast for teenagers and young adults living with type 1 diabetes. The podcast is not intended as a substitute for professional medicine advice or treatment. My guest for today is Adrianne Abed-Fitt. Hi, Adrianne. Welcome to Teen 1D. Can you tell us a little about yourself?
Hi, thank you so much for having me. My name is actually Adrianne Abed-Fitt. So a little bit about me. I am a Master of Public Health graduate. I work for county government right now, and I've been type 1 diabetic for about 6 years. I am in a good place mentally, so I am been very active in the JDRF community and trying to give back to other type 1s looking for support and resources.
How old were you when you were diagnosed?
I was 22. I just moved out of my parents maybe like 6 months before, and then I got slapped with that diagnosis.
How did the diagnosis affect you, considering that you were just moving out?
You know, it was very difficult in the beginning. I'm African American, so I have a lot of family members with type 2, and so they didn't understand that I had type 1, and it was a lot of learning on their part and kind of understanding how my condition is different from theirs and that they're both valid. It's just we treat it differently. And I was completing my bachelor's at the time too, so it was emotionally draining. I definitely had to reach out to different type 1 and non-type 1 resources to kind of get my mind right and get better at diabetes management. But overall, I feel like it was a good learning experience because it brought me on the path I am today.
So what do you like to do in your free time?
In my free time, I consider myself like a jack of all trades person. I like to do a little bit of everything. It really depends on honestly what my hyperfixation is at the moment. I love to read. I love to draw, sometimes do gaming with The Sims. I worked in the wine industry for a little while, so I like to go wine tasting and learn from, winemakers and sommeliers about different wines. And I enjoy swimming, cycling. Yeah, a little bit of everything. I'm willing to try new things as well.
What did you study when you were in college?
I got my bachelor's degree in women's studies and psychology. Women's studies, I like to say gender studies because people hear women's studies like, oh, so you just studied women for 4 years? Like, no, like we tackled the concept of gender and sexuality and through the lens of, history and science and art. And then I got my A in psychology and realized that I liked it, but I wasn't sure I wanted to major in it as like my bachelor's. It's so impacted here in California. So I decided to just minor in it and then do the gender studies as my main focus. And then I recently got my master's in public health in 2020.
Cool. Did you know that you were interested in these areas when you started college, or did you just find them along the way?
Gender studies I found along the way. So I went to Sacramento State, and I originally, like I said, was a psych major, realized how impacted it was. But I knew I wanted to be in health in some aspect. I didn't want to be a doctor, didn't want to be a nurse, but I wanted to help people because I like people. I'm interested in how people's brains work, how they make decisions, yada, yada. So I was pursuing biology for a little while, but bio is also very intense, very competitive, and I'm not very good at chemistry, I've learned. I've taken it so many different times with different tutors, different resources, and I just could not pass. So bio was looking like a no for me. And then I got diagnosed with type 1, and I could not handle the course load at all, and for people who have majored in very scientific oriented majors, there's a lot of math, there's a lot of tests and studying. And while I'm a good test taker, I'm a better writer. And so I wanted to pursue a major where I felt like I could capitalize on a skill I already have. Because I was dedicating a lot of my brain power to managing diabetes. And so I didn't feel like I could put in the work required to study for the math oriented exams. So I wanted to put my efforts into more writing based studies. And that's how I found gender studies. And it's a Bachelor of Science. So there's still a lot of like science oriented classes, but I got to hone a skill I was already pretty good at. And I was able to manage my diabetes better because I didn't have to work as vigorously in the test taking department.
So now that you're out of college, what are you doing as a
As I
career?
said, I work for Sacramento County government, currently with child support services. I help the child support officers essentially locate parents who owe a debt to the parent that's taking care of their child. I'll help locate their address, their current employer, any health insurance benefits, and make sure that the parent that's taking care of the kid has the financial and socioeconomical resources to, thrive and survive in life. Right now, I'm currently waiting for an interview for health education in Department of Health and Human Services, because that's what my passion is educating people about, day-to-day health things, I guess. And I am eventually going to get certified in diabetes education. So this child support services position is kind of a stepping stone to where I want to be in government in the future.
Yeah. Have you ever encountered anyone in your work with type 1?
Not type 1 at my work, no. My experience meeting other type 1s has been like finding people on Facebook, networking with JDRF, literally every other resource except work. It's been hard. Well, it was hard in the beginning because, I tell my employer I have diabetes and I have to have my blood sugar meter, yada, yada, and they just assume it's type 2. And at that point, it was very exhausting to have to explain to people that I didn't want to work for anyway. It was just a job that, I have a condition that you don't understand, and I'm going to need you to understand if you want me to work here, kind of thing.
So when did you get involved with JDRF?
I've been involved with them on and off since the beginning. I went to one of their conferences in the beginning when I first got diagnosed. It was my parents and my fiance. Actually, it was my boyfriend at the time. He went with us to kind of learn more about type 1 and the research in finding a cure and just overall management. But at that time, I realized that JDRF wasn't offering something I could handle mentally. I was being pulled in so many directions with school and my health and my parents. And so after that conference, I believe it was I took a break for a while because I needed to go to therapy and get more in tune with my needs and develop better coping mechanisms. So I recently got back into it last year during COVID, and I joined the outreach program and the YLC chapter.
So what kind of activities do these JDRF groups provide?
So the outreach volunteer program, basically we get paired with newly diagnosed type 1s or their parents. So when you get diagnosed with type 1, depending what hospital you're at, you get, a packet of information and you can check, and if you want to get paired up with someone to help you with the diagnosis process, with management and coping. So if they check that box, then JDRF, depending on where that location is, pairs those patients with appropriate outreach volunteers. Not unfortunately, but just kind of the fact of the matter, most type 1s get diagnosed as children. And so the parents normally want to talk to other parents of type 1. There's not as many people who get diagnosed with type 1 at my age, which was 22. So I've only had one volunteer patient so far, but I'm looking forward to, sticking with it and getting partnered with hopefully a team one day and who I can help with that process. Because I know it is a difficult diagnosis and a difficult life-changing situation.
Yes, but I think it would be really rewarding just to help people the way that you're doing it.
Oh yeah, it is. I love it. I knew I couldn't do it a couple of years ago when I was working on myself, but now that I feel like I'm in a better place, I'm enjoying it immensely. And then YLC is the Youth Leaders Committee. We have monthly calls where we talk about different type 1 topics. I know this past month we talked about traveling with type 1. We've had guest speakers do leading exercise like yoga and Pilates. We've spoke with different entrepreneurs who are working with CGMs and closed loop systems to better increase blood sugar management. So it's been really fun engaging with type 1s and essentially leaders in type 1 communities to spread knowledge and resource and a sense of community.
Yeah. What do you like most with your involvement with JDRF?
I feel like everyone understands. One of the when I was applying to be an outreach volunteer, they said, sometimes when you get paired with someone, it might not be the best time for you, and they don't want us to take on patient volunteers when we're not right with ourselves, so there's a lot of great transparency there that if we need to take a break or a volunteer isn't working right now, we can email our chapter lead and let them know, and then no problem, they'll get paired with someone else. And when you have type 1, you face a lot of people who don't understand. And it's nice that JDRF obviously understands from day one.
So right now with COVID, are the majority of JDRF events held in person or are they held virtually? I know that you mentioned your call, which was obviously virtually held, but I mean, in general, are they virtual or in person?
They have been virtual since last year, yes. I know the one walk in October is also going to be virtual, even though mask mandate and social distancing has essentially been lifted. It's still going to be virtual, I think, until the foreseeable future. We'll see what happens in 2022. And I think because there's great platforms like Zoom and Slack and Google Workplace, we're able to connect better with people who don't have the opportunity to meet in person. So I think there'll always be virtual events from here on out, but hopefully we'll have some in-community events starting next year.
And just a little bit back on you in general, do you use a pump or shots or a closed loop yourself?
I use a pump. I'm currently on Tandem right now, and I use the Dexcom CGM, and I'm loving it.
Yeah, I love the Dexcom personally. Have you ever had any type 1 related issues while you've been at work?
Yes, I've had plenty of lows, plenty of highs. I found out when I got this job, because normally I carry the emergency glucagon pen in my purse. And I told my supervisor that if you find me passed out or seizing or something, it's probably because I have low blood sugar. And I'm going to need someone to, inject me with my glucagon pen. And they can't do that due to liability reasons. So the only thing they can do is when they call 911, they can tell them, hey, she has this thing in her purse when you get here. So I'm like, okay, cool, awesome. So, I always make sure to be really diligent with my blood sugar management, but mistakes happen. It's not an exact science as much as endos and nutritionists like to think it is, but never anything. I've never had to go to the emergency room, never had to be, airlifted or evacuated. But just dealing it with myself at my own desk has been the main thing I've been doing.
Yeah. Have you experienced any positive outcomes from having type 1 or just being diagnosed?
Positive.
It's okay if you say no.
I think it's made me more aware of people who are different in general. I feel like when we think of diabetes, you think of type 2. It's just that's the default. That's what you mainly get diagnosed with. And, you don't even hear about type 1 diabetics. So it's made me realize that there are people with illnesses, chronic illnesses out there that no one knows about. And because no one knows about them, our rights sometimes get infringed on. We don't have the best rights at work. We don't get disability insurance. We have to fight our doctors for a diagnosis. So I think the positive thing is I feel like it's made me a better advocate for myself, and it's made me a better advocate for people who are in similar situations that I am. And if I can help someone have a better experience than I did, then that's a pat on the back for me, because it's really hard when you just don't know.
Yeah. And for our last 2 questions, I'm going to ask the same 2 questions that I ask all of our guests on our podcast. First of all, what TV show are you watching right now, or one that you would like to recommend?
Oh, right now, I am finishing up Lucifer on Netflix, actually. It used to be a show on Fox, I believe, but Fox canceled it and it eventually hopped onto Netflix for the final season. I love it. The Lucifer is played by Tom Elson, I believe his name is. And it's a really nice spin on who the devil is. And there's some detective work and crime. And it's really funny. And it's a really diverse cast of people. I love it. I'll be sad when I finish it up, but I definitely recommend if you're looking for a fun outlet to veg out to.
I definitely will get that a look. I have a friend who's been wanting me to watch that for a while now.
Really? Yeah, it's so good. You have to.
Okay. And as our final question is, do you have any advice for teenagers out there with type 1?
Yeah, it's the small victories that count. You're going to have bad days. You're going to be pissed off at your endo. I'm 28 and I'm pissed off at my endo. You know, that there's some things that aren't going to go away, unfortunately, but you're going to have little victories, and those little victories are going to get you through each day. And there's always someone who is there to help. It may not be immediate family if you don't have the best connections with your family and friends, but there are so many people with type 1 who want to help other type 1s, me included. It gets easier and you're not alone.
That's all for today. Thank you so much for being here.
Of course. Thank you for having me.
Yeah. If you have any suggestions for future topics or guests, or just want to say hi, don't hesitate to reach out. You can email me at teen.teen1d@gmail.com or DM me on Instagram at teen1dpodcast. Don't forget to subscribe, rate, and review, as it really does help me out. Thank you so much for listening, and don't forget to tune into next week's episode. Have a great week. We'll see you then. Bye.